today marks the exactly 2 years since South Africa confirmed its first COVID-19 case. Let's take the discussion further now and look at how far South Africa has come since the first case was detected and how the vaccination program is going in the country at this time. To take this discussion further, we're now joined via Zoom by the Deputy Director General in the National Department of Health, Dr. Nicholas Crisp. Doctor, it's always a pleasure to see you. Thank you very much for joining us here on SABC News, sir.
Good afternoon, Flo, and good afternoon to all the viewers. Pleasure to be with you.
You're welcome. The country marks 2 years now since a 38-year-old man who traveled from Italy was detected to have COVID-19. How far would you say, we've come, especially the health department, in this fight against COVID-19 since that very first case?
Flo, thanks very much. It's not only a question how far the health department's come, it's how far we've come as a nation, because we don't operate alone, and there have been a number of mistakes made along the way or difficulties encountered along the way. But overall, we have, I think, done a remarkable job, and we have been congratulated by the World Health Organization and other countries. Yeah. So I don't think they would say that lightly. So, it was devastating 2 years ago, and we rode it out for a while before we got vaccines in February last year. And now we're at a stage where I was in a shopping mall today looking at a couple of vaccination sites, and people are still vaccinating, but the malls are busy and people are trying to get on with their lives. Yeah. So I think we've made remarkable progress.
Doctor, we understand that the Department of Health is planning to introduce some policies, new policies that may allow the removing of some of the COVID-19 regulations. Can you talk to us about these particular policies and what the aim is here? I mean, interestingly, obviously, as someone who's also been living in this situation where we're dealing with a pandemic, one wonders when, for example, we'll be able to remove these masks that we've been wearing for 2 years. And also, interestingly, we're still actually in lockdown, although it is level 1. But things like that, I'm assuming, are some of the issues that you're looking into?
Yeah, Flo, so the health department is, as I said, not the only department. Government acts in all of this together. Obviously, we are the major player and the lead, especially in the vaccination program, and we are the ones who comment in the various government meetings about whether we think we are safe to move some of the restrictions, including testing, tracing, isolation, quarantine, and so forth. But there are a number of other players involved, and there's lots of consultation that takes place, both inside and outside government. So that all culminates with recommendations at the National Corona Command Council meeting, which there's due to be one this week. And usually what follows after that is that the president then makes announcements of those changes that have been agreed to in the NCCC, then being cleared with the premiers of the provinces and cabinet. So I'm not at liberty to discuss all the things on the table, but I think the president and the minister have both spoken several times about the desire for us to move out of the restrictions we're in. But we need to do it in a responsible manner. COVID is not gone, despite what some people are saying. We're still seeing sick people, and we are still seeing people dying. So we do need to be a bit cautious. We do know that we are likely to get a fifth wave based on the patterns we've had. And I would just encourage everybody to be a bit cautious for now, to please go out and get vaccinated, because we know that that's the way to get the greatest immunity in the community. And you will hear the announcements from the president in due course.
Yeah. Can you give us an update? I mean, I heard you talking about the fact that you're at a mall and you saw that, some of the vaccination sites, people are still actively going to go get vaccinated. But let's talk about the vaccine program in the country and how it is, I'm talking officially now, how it is proceeding. And I wonder if you're still at a point where you believe that, not enough South Africans have been vaccinated, and are we not where you would have liked, those numbers to be of fully vaccinated adults?
Yeah, Flo, no, I'm very disappointed with where we are. I'm responsible for leading the program, and there are thousands and thousands of people working very hard, especially in the health system, to make it available. We have brought in, we will have altogether 70 million vaccines. We've administered close to 32 million. We've got 25 million doses in the country at the moment, and we're struggling to get them into people's arms. So that's disappointing for us because of the huge amount of effort that we put in. So people ask me, why are we not opening up stadiums and why are we not just, freely taking off masks like other countries? Then they refer to other countries whose vaccination coverage is 92, 94, 91, 90%. And the lowest we've heard is a country whose adult vaccination coverage is over 70% already. And the answer is pretty simple. If we don't get our vaccination coverage up to that sort of level, because we can't take the risk, notwithstanding the surveys that have been taken, that wild immunity from wild virus is sufficient. We do need to sustain, maintain, build, and strengthen our immune systems if we're going to tackle whatever's coming down the line next.
Yeah.
So I'm happy with what the health services have done. I'm thrilled with the cooperation between the public and the private sector. I'm ecstatic about the way in which our own department has managed to be so flexible and quickly respond to some of the changes. But I'm disappointed that it does not have the overall effect.
Yeah.
And I would like to appeal to everybody, companies, government departments, entities, whoever's out there, get your staff motivated, provide the right facts, and get people vaccinated.
Doctor, one of the other things that we'd heard this week, the health minister was talking about some vaccines or a large batch of vaccines that would be expiring at the end of the month. Can you give us some clarity on this particular issue?
Yeah, so the situation is that we have Pfizer vaccine, which when it is manufactured, it has a 9-month expiry term.
Yeah.
By the time it arrives and it's cleared and it's in South Africa, it has anywhere between 7.5 and 8 months of expiry date, until the expiry date. That vaccine is stored centrally at minus 70 degrees, and then down the chain, it's reduced to minus 40, and then eventually by the time we get it, it's in a fridge. So the chain of the distribution of that vaccine is vulnerable to temperature and to light and so forth. All vaccines are, but this one is particularly difficult to manage. We have a batch, so we have been receiving batches that range anything from 1.5 million doses to 3 million doses at a time.
Yeah.
over a long period now from Pfizer. And this batch of doses the minister was talking about is around 100,000 doses, which expire on the 31st of March. But we have filled all orders up to Friday, and that's what's left. Now, we are not keen to push that last 100,000 doses into the delivery chain because the risk to the vaccination sites is they won't be able to use it, and then it has to be destroyed at 3,000 sites around the country. It is far easier to contain it, quarantine it, and destroy it in the center. Now, it sounds like a huge amount of vaccines, but out of the 32 million doses, or almost 32 million doses that have already been administered, it isn't that much. Every dose is a waste, and we are extremely disappointed to lose it. But it is the more responsible thing to do to prevent fraud, corruption, selling of it, and the burden of destroying it in the periphery.
Yeah.
So that's what's at risk at the moment. We'll take final stock on Monday morning. And if some people are able to take vaccine, that's fine. But we have managed to distribute all of the vaccine that was due to expire at the end of April. So that's really good news. So that's all that's at risk at the moment.
Yeah, and as we wrap up our conversation, I think it would be interesting also to get an understanding of which age group really are recording higher numbers of positive COVID-19 cases, and if that number then also correlates with the number of unvaccinated people. I hope you understand where I'm going with this. I'm trying to see, in terms of which age group is really in the danger zone, maybe those that aren't getting vaccinated and also still on the back of it recording the high numbers of positive cases. I mean, do you have that specific sort of data? Yeah, we do. We have a lot of very detailed data, but I'll try and keep it simple. I know we don't have a lot of time. People over the age of 60 are greatly more at risk of contracting the disease, irrespective of any other illnesses, purely on age. So they are our main target, and that's why we started vaccinating them first, and they are well covered.
right throughout the country, they are between 60 and 70, and in some places 75% vaccinated. That's encouraging. As we move down the age categories, the population in those age cohorts has had less time to vaccinate, so we can expect that they're not as well covered. But disappointingly, between 18 and 35, and from 35 to 49, the figures have not been catching up very fast. Now, that population is at lower risk because they're the healthier people at a better, and their age is less of a risk, but it doesn't mean they have no risk. So our concern is that people in those age groups congregate and are a source of spreading of the vaccine, and they are at a risk if they don't have excellent immunity. So we would like to encourage younger people. We know you haven't had as much time to get vaccinated as older people. We know that you're at lower risk of severe illness, but you are not at no risk at all. So please come and get vaccinated.
All right, Dr. Nicholas Crisp, appreciate your time, sir. Thanks very much for joining us on the show. All right, that is Dr. Nicholas Crisp, Deputy DG of the Department of Health.